It is 2 o'clock. This is Ani Turner of Altarum, and let's go ahead and get started. So I want to thank all of you for joining us today for our webinar on equitable solutions for the direct care workforce. I am again Ani Turner, Senior Economist with Altarum's Center for Elder Care Improvement. And I'm delighted to be moderating the first in a series of 3 webinars sponsored by Altarum, looking at solutions to challenges in long-term care and how these challenges and solutions overlap with issues of gender and racial equity. Altarum's Center for Elder Care Improvement, which is led by my colleagues Ann Montgomery and Sarah Slocum, has deep roots in working to create a public commitment to high-quality long-term care and in designing and facilitating changes in policy and on-the-ground practice to create a better system of care. And current areas that we're focusing on included advancing comprehensive culture change in nursing homes, working at the state and community level to incentivize more robust systems of home and community-based services, and building out an economic case to support investments in things like strengthening the direct care workforce, the topic of our webinar this afternoon. So as moderator, let me give you just a bit of my background. I've spent much of my 30-plus year career studying the health workforce, modeling supply and demand, looking at strategies to alleviate shortages, including recent work with Sarah Slocum and our partners at PHI here in Michigan, characterizing the direct care workforce and making recommendations for strengthening that workforce. I've also partnered over the past decade with the W.K. Kellogg Foundation on modeling the economic benefits of advancing racial equity at both the national and the state level, what we call the business case for racial equity. And what I see is that the direct care workforce is at the intersection of so many of these equity and long-term care issues and challenges. We all want access to qualified and reliable caregivers for ourselves or our loved ones when the time comes, but as a society, we simply don't value this work enough to offer those who are willing to do it, who are mostly women and people of color, a living wage. Direct care workers typically earn about $20,000 a year, typically don't have benefits. The training may be minimal or uneven in preparing people to face the physical, emotional, and interpersonal challenges of what can be a rewarding but very difficult job. And often direct care workers have to put up with unpredictable hours and schedules. So it is a job that I know those of us on this call very much appreciate, and then many people view as a calling, but it is not an easy job to hold and to be sustaining a family. So it's not surprising then that many direct care jobs are going unfilled. There are high vacancy rates and that turnover rates are staggering. A recent study found that 100% of direct care workers in nursing homes turn over in the course of a year. Many leave the field for better paying, more stable, less demanding jobs in other sectors. So how can we change that? How fast? So we're going to explore those questions today with our amazing panelists. I'm going to end my remarks with a few housekeeping measures, but let me just pause here and say regarding this technology, everyone is automatically muted, but apparently we don't have a way to centrally turn off everyone's camera at the moment. So those of you who are on the call, just double check that and make sure that your camera is off and turn it off so that when our speakers begin to talk and we see their faces, we don't have a number of other faces also on the screen. So please check your cameras, turn them off, and thank you. Let me move on. So how does the quality of direct care jobs intersect with issues of equity? When I have studied racial equity, I and others have shown that average earnings of people of color are about 2/3 what their non-Hispanic, white, age, sex counterparts earn. And part of this is due to higher unemployment, higher incarceration rates, and part is because average earnings tend to be less for people of color. So One question is, do people of color and women, also for that matter, earn less because they disproportionately work in occupations like direct care, which don't pay well? Or is direct care work valued and compensated less because 80%, 86% of direct care workers are women, nearly 60% are people of color, and about 1 in 4 were born outside the US? And I think, unfortunately, the answer is both. The arrow goes both ways. So this also, however, means the good news is that improving the quality of direct care jobs, paying a living wage, for example, can both strengthen our system of long-term care and advance social justice goals of greater racial and gender equity. So today I'm very excited to welcome 3 outstanding speakers and longtime long-term care workforce advocates, Congresswoman Debbie Dingell, Ms. Henrietta Ivey, and Dr. Robyn. Our speakers are working on driving solutions at multiple levels, from grassroots organizing to the application of research, to the development of local and national policy, to the mechanics and politics of passing federal legislation. So before I turn things over to Congresswoman Dingell, our first speaker, again, let me go over a couple of housekeeping items. First, we are recording this webinar, and the recording will be available shortly after we're completed. We'll post it on Altarum's YouTube channel, and we'll be following up with everyone with an email that will include a link to the recording. Again, everyone who is attending should be muted, but double check, please, that your cameras are turned off. And we will leave time at the end for questions and answers, and we're going to be using the chat function for Q&A. So the chat icon looks like a little speech bubble. Please feel free. We encourage you to type in your questions as they come. You don't need to wait until the end, and we'll be checking the chat box and reading out as many questions as we can for our speakers at the end in the last 10 or 15 minutes. And if time allows, we may pause after each speaker and see if we can fit in 1 or 2 questions at that time as well. And so now it's my great pleasure to introduce Congresswoman Debbie Dingell, representing the 12th District of Michigan in the U.S. House of Representatives here in Ann Arbor, Michigan, where I am and Altarum is headquartered. Congresswoman Dingell has long worked, as many of you know, to advance policies to strengthen the workforce and improve systems of long-term care service delivery. And she's at the forefront of legislative work on community-based services and increases to the minimum wage. I've had the pleasure of hearing her speak a number of times, and I know that on both a personal and a policy level, she's very knowledgeable and passionate about these issues. So again, folks, I want to remind everybody, please turn off your cameras. If you can look for that camera icon and just click on it, I would appreciate it. And with that, I'm going to turn things over to Congresswoman Dingell.
Thank you, Annie, for that kind introduction. And thanks for asking me to be part of this critical conversation today. Thanks to the Altarum team. Thank you for the work that you do every day. Thanks for convening this conversation on an important Women's Equity Day, actually, Equal Pay Day. So that is another good day. And all that you're doing to support our direct care workforce. It means a lot. And to be with my other 2 speakers, Henrietta, I haven't Zoomed with you in 2 days, but she does so much fighting for the workers and for long-term care. I'm just honored to call her a friend and someone that I work with. And Robyn, thank you for your commitment to this cause and the people who rely on home and community-based long-term care. You guys are warriors. There would not be there wouldn't be a system without the workers who carry it on their shoulders. So I'm really honored to partner with you in these efforts. But maybe before I begin to talk about this, I'll tell you why this is such a personal issue to me. I don't think people think about long-term care. They don't think about how broken or fractured the system is until you're in it. And I think the pandemic and COVID-19 has shined a light on how fractured the healthcare system is and how fractured the long-term care system is. And we've seen what has happened in long-term care settings, communal settings, the rapid spread, and unfortunately the death. But for me, it had to do with a man that I loved, who the day after he retired from his job, I took him to a new doctor, and the new doctor immediately put him in the hospital and said to me, I think he finished his life's work and he could die this weekend. He lived another 4 years, and every one of those moments was rich and wonderful. But it was also, I want to be very clear. I know that I'm luckier than 99 and 9/10 of the people in this country. I'm supposed to be able to navigate bureaucracies. I know how to advocate. I know how to yell and scream. I know how to fight. And there were days that I would just be in tears trying to make sure that he was okay and get the system to work. From the hours spent punching the dials between insurance companies and Medicare and who was the primary care, the primary provider. But even I didn't know about, hey, if you're in the hospital and you need care, in-home care, after that better not last more than 90 days because boom, it's not paid for anymore. And later down the road, while his mind was 100% there, his getting around wasn't as easy, and I couldn't leave him alone, though Lord knows he wanted to be left alone. And his dignity, his pride was always there. And trying to find responsible caregivers, and pay them enough. You met a lot of people that have been disrespected, not treated well. And these were people that I was trusting with the life of the man that I loved with my whole heart and soul. I really learned in those 4 years what the challenges were for caregivers and for those that were receiving long-term care. I was lucky enough that I could keep my husband at home. And I think more people should be. We need to fight so that we do have more home community-based care so that people are able to stay in their own homes, which are where they are the happiest. It's where they've lived all their lives. We don't make them feel isolated or put them into an institutional setting. But many of the caregivers are working 2, 3 jobs. They're still below the poverty line. And some of the people that I had one woman that was my angel. I don't know what I would have done without her. But sometimes I had to go to an agency, and these women didn't have, they worked their hearts and their souls off, but they were working and going 2 or 3 different or 4 places. One instance, and you're carrying things between the places, and they're exhausted. They're working their hearts and soul out. They're not being paid benefits. They're not. I will not pay at least $15. I paid far more than that. But the agencies would charge you more, and they weren't paying those healthcare givers $15 an hour, and they weren't paying them benefits either. So I really learned how broken the long-term healthcare system was in this country, living it myself, and giving my husband the quality of life that he deserved and getting to know caregivers. So I share his story and our story because it matters. And it matters to almost every single family in this country. It's a conversation that's long overdue. Robyn says she's been working on this since Claude Pepper in 1989. It's true, but we kind of lost this discussion for a while. And COVID has just shined a light on it, although I've been screaming about it. And when I went to Congress, told everybody long-term care is going to be my issue, healthcare, because it is a broken system. And until you've been in it, worked it, try to get people to help you, you just don't know. It's a conversation way overdue. In the American Rescue Plan, we were able to secure nearly $13 billion to support home and community-based care. It's absolutely critical funding that helps seniors and people with disabilities while protecting providers who've been on the front lines of this pandemic. This provision provided a 10% point FMAP increase in funding for home and community-based services through Medicaid for the next year, which is also a much needed investment in our frontline direct care workers and those that they serve. This is the first dedicated Hcbs provision included in any of the COVID relief bills, and it provides significant relief to meet immediate COVID-specific long-term care needs that have gone unaddressed for far too long. In fact, it was just over a year ago when I first introduced the Coronavirus Relief for Seniors and Disabilities Act in the House of Representatives, which contained or included standalone funding for the Hcbs. It is thanks to the efforts of advocates like those of you who are with us today over the past year, we were able to get this done and see it through. First as a provision in the HEROES Act, then as an improved standalone bill, and finally a fully funded provision in the enacted American Rescue Plan. Additionally, this significant new Medicaid Hcbs funding sets the stage for further action in the follow-on recovery package to finally reform our nation's very broken long-term care system. I was glad to see Joe Biden, when he was a candidate, have a $450 billion Hcbs proposal released during the campaign. And my immediate goal right now is to ensure that that commitment is upheld as we look towards the next major legislative initiative. That's why I'm leading a letter with many of my colleagues to President Biden and Vice President Harris, requesting inclusion of this provision in the next recovery package. We already have 70 members of Congress from a wide cross-section of the Democratic caucus who are supporting this proposal, and I'd welcome all of your help in getting other people. We need to reform and rebuild this system. So our work's just beginning. We got to work together, and that's why I'm so happy to be part of this panel today.
Thank you so much, Congresswoman Dingell. Appreciate your remarks and your dedication to these issues. And I'm going to just keep the discussion going and introduce our next speaker. And we'll go ahead and just leave time for discussion and interaction and questions at the end. But I want to introduce Ms. Henrietta Ivey. And Ms. Ivey speaks authentically and passionately about the challenges faced by direct care workers and what needs to be done from her perspective as first a family caregiver, then a professional direct care worker, and now an advocate and an activist fighting to gain respect and recognition for direct care workers. She's the founder of Black Women in Home Care and also a strong voice in the fight for 15. So with that, Henrietta, I will turn things over to you.
Thank you so much. Let me first say that I am honored to have sat here and listened to the amazing Rep. Debbie Dingell. I have known Debbie Dingell for a while. I met Debbie Dingell in my first fight with the Fight for Home Care, and she's been a trailblazer and a leader for us for a very long time. So I am honored that she is sitting here with me today and that she's fighting this good fight with me and all the care workers in this workforce. As most of you know, I started this road as a home care worker when my grandmother got ill. My grandmother, a 4'11" woman, matriarch of the family, strong, amazing mother, grandmother, aunt, taught us how to love, taught us how to care. And what I come to realize, and I didn't mention in that time, but when I was advocating, that my grandmother was a domesticated caregiver for 30 years. So I want to say that and honor her. She's no longer with us, but I want to honor her in that. And when I thought about that, I said, wow, grandma was a caregiver and a domestic worker. Her passion and her pride in that work, I feel, is what fueled me to do what I did when she became ill. I became her caregiver until the day that she passed away. What got me moving in this work was when I took her to her last appointment, and she was diagnosed with congestive heart failure. And in that visit, I recognized that she was breathing really hard. She was having a hard time speaking, catching her breath. And as I'm sitting here watching it, now mind you, I'm a young mother and wife at the time, and I'm looking at her and I'm looking at the reaction of the physician, and he's not really giving her much care. He's just kind of like taking short notes, but she's breathing. She's really having a hard time breathing. And he said, she was explaining to him, she said, "Well, I can't breathe. Is there anything you can do? Should you increase my medications?" He said, "No, Miss Ivy, you're fine. Just keep taking your medication and we'll see you in a week." Well, grandmother never made it to a week. She died 4 days later. That was in 2004. That set something off in me to never let another person or another family experience what I experienced as a granddaughter, as a caregiver. So my work is deep rooted, deep seated, and passionate because of that. When I hear the stories of other home care workers talk about how they are suffering because they have low pay, no benefits, no days off, long hours, multiple clients, they're burnt out, they're stressed out, they are depressed because they're working to try to make a living in a job that they love doing, but really can't afford to do because they're not being paid to even furnish their own lives. Knowing that all these stories and hearing the stories over and over again for many, 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 many years has set me to advocate and activate for this workforce. Yes, I am an advocate because I feel that home care workers deserve a livable wage, benefits, compensation, respect, and dignity for the work that they do for other families. And like Rep. Dingell mentioned in her speech, these families get to keep their loved ones in their homes. These people who have worked so hard for a home that they paid and bought, and now that they're ill and they can no longer do anything for themselves, they can now stay in their homes because of people like myself and my colleagues and my counterparts who do this work. The pandemic has awakened these issues and has brought them to the forefront. And many lawmakers are now talking about home care being essential. Thank God for that. Because for a long time, we fought and we fought and we fought and we told our stories and we gave our pleas. We showed every way that we could why we were asking for livable wages, why we were asking for benefits, why we were asking for compensation, why we were asking for all of these things that were mentioned long ago. We've been asking, and thank God today and moving forward, lawmakers like Debbie Dingell, researchers like Empire Alliance, Claire Liz, Altarum, Sarah Slocum, and PHI, Emily Dippa. All these wonderful people who are now trailblazing with the care force has now brought it to the forefront, and we are now starting to see the ball roll for home caregivers in this workforce. I am again honored to be part of such an amazing team of people who have heard our cries and is now helping us fight the good fight and getting all the things that we've been asking for, and we will get it. So I leave everyone with this thought, with these three letters, RPP. And what does that mean? It stands for respect us, protect us, and pay us. And to also remind everyone, if it's not for the caregivers, we are the backbones of the healthcare system. We take on the load when their systems can no longer take on the load of people such as our elderly coming in quite often because they're at home and they're alone and they feel like no one care about them. So they back and forth into the emergency rooms, and they need that compassion. They need to know that somebody care. Caregivers are in those homes to help them along the way and it keeps down the cost of hospital having to take on that burden. So again, I am more than honored to have been sitting on this panel with such distinguished members and people who are fighting with us. And I am going to stand this fight until this victory is won.
Thank you so much, Henrietta. I think here at Altarum, when we talk about these issues, we agree that we think we are in a moment. We think and hope we are. And so we want to do everything we can to take action and capitalize on it and work quickly. And I know all of the distinguished speakers here and the several hundred people who have taken an hour out of their day to participate, hopefully will join us in that. So I'm going to move to our third presenter, Dr. Robyn Stone, and then we'll have some discussion. So let me introduce Dr. Stone. She is a esteemed, nationally recognized expert on aging and long-term care policy, whose 40-year career, as was alluded to earlier, has been at the intersection really of research and policy, and has included leadership positions in the federal government, private sector, and academia. Dr. Stone served in the Clinton administration as Deputy Assistant Secretary for Disability, Aging, and Long-Term Care Policy, and as Acting Assistant Secretary for Aging. And she currently wears two hats as Senior Vice President of Research at LeadingAge and as co-director of the LeadingAge Long-Term Services and Support Center at UMass Boston. Dr. Stone has written books and numerous publications in the field, and one piece of special relevance, I think, to us at Altarum and to this discussion is LeadingAge's recent groundbreaking study called Making Care Work Pay, which really compiles and synthesizes and looks at all types of economic benefits to paying direct care workers a living wage, from benefits to those workers and their families, and to the care system, and also to communities. And that is exactly the kind of work I think that we want to continue to pursue, to put forward this argument and to support investments in this workforce. So Robyn, I'm delighted to turn the floor over to you.
Thank you, Annie. Thank you, Representative Dingell. Thank you, Henrietta, and everybody else that's on this call. This is a passion of mine. I too have a story several stories of a family experience that I could go into, as well as starting as a candy striper in 1967 in a nursing home in Baltimore, Maryland. And I wish I could say that the frontline workforce has gained a lot since that time, but I really have not seen enough movement. And I think maybe the time is ripe right now. I work at LeadingAge, which is a national association of over 5,000 nonprofit aging services providers. We represent the full continuum across nursing home, assisted living, home care, hospice, home and community-based services, adult daycare. And the bottom line is that it is the people stupid. 60 to 80% of all the services and care that are provided by frontline professionals. I don't refer to Henrietta as a care worker. She is a care professional. We just finished competencies at LeadingAge a couple of years ago with 18 pages of competencies for what frontline professionals need to be doing. These are professional occupations that are paid low wages. And somehow we have to turn this around. I have a unique ability or skill sets to actually be able to bridge the worlds of research, policy, and practice. And that has been sort of my game, which is to say that we need our stories, we need advocacy, and we need good data to support why these are professional occupations that need to be recognized, respected, and also identified as really the way that we're going to get to quality for all the people that we love and all the people that we are serving. And I'm going to spend just a little bit of time today talking about our most recent report because it comes with some hard data, some modeling that we did, and it shows the benefits to everyone of investing in a living wage. And I have to say that I want to acknowledge my co-authors on this study, Christian Weller, who is now in Germany, and his wife, Beth Almeida, Mark Cohen, who is my co-director of our center at UMass Boston. This was driven by a major workforce goal that LeadingAge has right now. It is one of our strategic goals for our whole organization, as well as our state affiliates, to make this better, to make sure that we have improvement and transformation around the workforce for the few years in the future and for the future to come, because these challenges are just going to get even more compounded over time. So let me talk a little bit about why I think this is so important. We looked at and we modeled what would happen if we rose every single frontline professional's wage to a living wage in their own market. This is not a minimum wage of $15. This is actually a living wage where people can live in DC, which right now, for example, has a $15 minimum wage, and that's not enough for most people to live on. So we have to recognize that the livable wage is what is going to be very critical for us. And when we did this modeling, and we modeled it at the state level as well as at the national level, we really found that there were tremendous benefits to the workers, that on average, these workers were, in really bad shape. You've heard this about how low they were paid, how many lived in poverty, how many were really having to look to public assistance. And a meaningful increase in pay would reduce these financial hardships and increase financial security for many of these frontline professionals. So let me tell you a little bit about what we found. First of all, $5.5 billion expected minimum increase to total productivity if we raised in 2022, if we raised everybody's salary, everybody's wage to the living wage. That is $17 to $22 billion added to the local economies, because direct care workers now have money in their pockets to spend additional income. In addition, we could save up to $1.6 billion each year from government public assistance programs, because many of these folks are on Medicaid, they're getting SNAP benefits, and a lot of other benefits that we could be weaning folks off as they were being paid a livable wage, and I would argue probably even higher, for the competency-based work that they do, for the professional occupations that they serve in. In addition, this enhanced retention and recruitment would add the equivalent of about 330,000 direct care jobs to the ranks of those already employed, a 9.1% boost to employment in 2022. I think we have to think about not just the challenges of the living wage, but what does this mean for all of us? The direct care professional gets more money in her pocket to care for herself and her family, her kids, to make sure that her car is running. The care recipient, of course, has a much more stable workforce, because we know that higher wages are directly tied to retention. And we've seen this in empirical work that I've done and other folks have done across the country. So as these wages are raised, we see lower turnover, we see a much more stable workforce, and a greater potential for every single consumer to receive better quality of care, more stable quality of care, more consistent assignment from the same workers who don't have to be working for 3 and 4 jobs in order to make ends meet. And then finally, we see this big benefit to the local economies themselves, because we will see greater investment in productivity and a boost in the economy just from the fact that the direct care workforce, the caregiving professionals, are actually going to be spending their money in their own communities and building their communities over time. So let's all think about not just the challenges of a livable wage, but let's think about the potential benefits to every single stakeholder of what can be done when we actually have a livable wage. And I would also end by saying that this for us is just one of the building blocks. We started with the livable wage because it is untenable that in this day and age, we are not paying these professionals what they should be earning, not just because it's the moral thing to do, but also because this is the competencies that these folks have. They're documenting, they're observing, they see changes in condition before any other clinician can see it. They are the folks who are the emotional underpinning of the people who are getting care, and frankly, for many of these families. They're doing unbelievable work in dementia care, in oral care, in helping around medication management by observing. And so it is really critical for us to think about the livable wage as the beginning of a framework that also focuses on training, ongoing investment and support, and advancement opportunities so that aides who want to move up or move sideways into specialties have real opportunities in these professional occupations. It has been over 40 years that I've been in this, and workforce has been one of my areas of research and policy work for almost that entire time. The pandemic has reared its ugly head in terms of showing the challenges to focusing on this essential workforce. And I think we've got an opportunity, hopefully between a combination of good research, great practice, and translation into good policy, we can see this happening as a real transformative moment. Thanks.
Thank you, Robyn. And for those who are so inclined, I would highly encourage you to check out the LeadingAge report. It's excellent. It's an excellent work of modeling, and also, as I said, synthesis of a lot of existing research on both long-term care and direct care jobs, and just general labor market research as it relates to this. So I would like to turn the discussion to be a little more focused on current calls to action and solutions. You know, I think most of us on this call understand well many of the challenges, from wages, lack of benefits, lack of stable hours, ability to be earning a family and self-sustaining wage, the lack of respect and recognition that these positions are professional positions that require a whole range of skills and training, you know, when it comes to training too, I think it's understood by folks who look at these issues and at this workforce that the training can be uneven, and training requirements are uneven, and even those who have a certification, that may be 70 hours, 75 hours, and these are very, very important and should be highly valued and well-trained and consistently trained occupations that have an opportunity for progression, for adding in kind of modules with particular skill sets. And as challenging as things are now, with turnover and occupancy rates, and with a very large group of people, 4.6 million people work in direct care today. That is a big chunk of the workforce. And I will just throw this out for comparison. You know, when we look at other sectors of the economy and occupations that are part of the national discourse, and I'll pick one, coal miners, when we're talking about energy. I think there are on the order of 50 or 60,000 coal miners in the United States. There are 4.6 million people that we would classify as a direct care worker or professional. And the numbers are growing hugely. Again, PHI, who really publishes kind of the gold standard of data on these workers, is projecting another 1 million more jobs will be needed over the next decade. So one of the questions that I have that I would invite our speakers to comment on is, what about the increased need for these workers, given all of the challenges? We know people are continuing to age, need more and more of these services. We know this is the fastest growing occupation, I think, by BLS projections, and already occupancy rates are high, turnover is low, but that does not seem to be moving the market on its own to increase wages and benefits and all of these things that, a perfectly competitive market, one would think, would cause to happen. So are there any particular strategies that we need to embrace around recognizing this growing gap between what we need and what we're likely to have? Do we want to quantify and really push out that gap? Do we need targets to grow this profession? You know, is this another aspect of really advocating for making these kinds of changes? Or is it more a matter of just seeing that this is coming and knowing we have to keep on doing all of the things that we're doing, given this growing kind of gap? Robyn, you look like maybe you're about to add here, so I'll start with you on this.
Yeah, I mean, I don't think there's a magical solution. I think this is a multifaceted systemic problem, and starts with an undervalued long-term care, long-term services and support system that's been the same as long as I've been in this, and my entire career has been in long-term care. You'd think I'm crazy, but I keep on working on it. Mm-hmm. It's a very undervalued sector, partly because people don't understand how complex the work is in what we do, whether it's in a nursing home or in home care. And actually home care is more complex because you've got one person in the home, typically, as Rep. Dingell was saying, with very complex people. And, you know, you have to actually understand a lot in order to do that. So these are undervalued, and we're also heavily dependent on public payers, particularly on the home care and nursing home side, the Medicaid program. And while we, some of us are trying to figure out a little bit better what it really costs to deliver these services, we do know that Medicaid reimbursement in many states is not adequate. And so one of the ways that we have to think about this is, how do we think about reimbursement rates that are adequate? Where do we get that money from? Is society behind us in terms of, it's not just the legislators or the executive branch in these states, it's every single person that needs long-term services and supports at some time in their life. Are we behind? Are we willing to pay more for these occupations that are essential? So that's one way that we have to think about it. We also have to look at how we may redistribute dollars that are already out there in the system. Because to my mind, we're all out of whack when we have these frontline caregivers who are 60 to 80% of all the services that are delivered, and they are the lowest paid in our system. It makes no sense to me. It never has. And I do believe underneath all of that is a systemic racism problem, which is, as you said, about 60% of these folks are people of color. So, you know, you can't attack this with one solution. We have to have multiple solutions. We have problems with nurse delegation, so we can't allow our aides, our frontline, to do more because nurses in some states, the delegation, the regs prohibit that. So we have to take a look at nurse delegation. We need to look at how our training is established, and can we at least have standards across states that make some sense, that set a floor for how all of us are trained, so that the professionals can move between settings and can move across states. So I would suggest that there's no magic to this. It's a lot of hard work. It requires money, but more than money, it requires strategy in terms of thinking about how everybody sees this as a win-win, and how we're all going to have to come together around figuring out how we pay for it, and then how we actually train for it and sustain it over time, because it's all about the people. Robots are not replacing us anytime soon.
Absolutely, absolutely. Yeah, excellent summary of the many levels at which this needs to be addressed, and you know, training, as you said, being key, not just for the direct care workforce, but for the whole, all of the members of the care team.
Absolutely.
Absolutely. Congresswoman Dingell, any comments that this discussion is spurring in your mind? Oh, you need unmute. You need to unmute, please.
Sorry.
That's okay. Thank you.
I agree with everything that Robyn said, but what people don't, Medicaid is the single largest payer of long-term care in this country. But what people don't realize how expensive it is and how hard it is to get until suddenly you need it. And I've been struck by how many people's lives have just been turned upside down in the last year. You know, that's what happens to someone. You have an incident and lives are never the same, which is one of the things that we've got to figure out how to deal with. But people don't understand that when you need long-term care, Medicaid's going to pay for it, that we require people to have no assets.
Sure.
You have to be at a certain income level. So it's one of the reasons we've been doing the money follows the person, and also been trying to spouse empowerment. And that means if you're married, it's your combined assets. So your spouse has to have no assets either if you're even to get your long-term care covered. And then, as you said, Robyn, it's not covered. I mean, it's an insane system.
Crazy.
And all of a sudden you're in it and you're already emotionally traumatized because your life has changed, unfortunately, sometimes forever. And then you have to be impoverished and you don't know. I mean, and there's not enough places to go either. There's a shortage of caregivers and places to get treatment. And when you talk about education, it's also educating the patients. I mean, I learned a lot about congestive heart failure, and congestive heart failure can be managed in the home by both the patient, the patient's spouse, and the caregiver. And I could go through things like that. So there's a lot of education involved here too. It's a broken system that needs to be redesigned.
Absolutely. Henrietta, I want to just give you an opportunity to weigh in here, and I'm also looking at things that folks are posting in the chat, and I'll turn to that in a minute. But anything that you'd like to add?
You know, I would have to say that I agree with Rep. Dingell and I agree with Robyn. And what I'm finding that tends to be the reason, the lack of training, wages and all of that, it all starts too, like when you have, like Rep. Dingell just stated, when you have two people in the house and you have an income, right? If that income did not yield a strong pension, and a person as they get older, they don't have a lot of money saved because they didn't really have a job that paid them well, but they did the job because that was all they had. It all goes back into the wages, whether it's the wages that we're paid or the wages that the ones that we're taken care of that they made that did not suffice them to have those benefits as they age. So it's tied into a wage. If this country can actually think about the beauty of what a wage could do for a family right now, $15 and moving up, if we can get people on this mindset that it takes money to live.
Yes.
As we age, if we don't make enough money and we work somewhere 30 years and we get sick, then we're going to have to rely on the government to give us that other resource. And even if we made enough money to where we can retire, there's always going to be that gap of something that's going to be more expensive than what we anticipated for, what we didn't save for, because we don't know how things are going to change as we move into the change of the world. So it ties into wages, and it ties into knowing that people need wages, livable wages to survive. Whether you are a worker or someone working to take care of you, we all need wages. So I think if we can get on that mindset, we can get the country on that mindset that people need livable wages when they're working. So when they retire, they can have at least some type of resource that they can lean on, where they don't have to lean on, or for the workers who's doing this work now, 30 years from now, when I retire, I'm 10 years out of retirement now. In 10 years, I will be retired at retired age. In 10 years, I will be 65 years old. That's a short time, very short time. So if I don't get on the ball now and fight for what I'm fighting for now, I will be one of those people who's going to need care and won't have the proper adequate care because no one's going to take care of me at no low wage. So it ties into the wages.
Mm-hmm. Yep, absolutely. So
Yeah, if I could say one other thing, one of the things I didn't mention about our modeling, we actually found that by paying a livable wage, we actually attracted workers from other industries into direct care work. So you actually begin to build a pipeline, more of a pipeline, because you're paying a livable wage, because we didn't even talk about the pipeline. I mean, this challenge is going to get worse because we're going to have fewer people available and probably fewer family caregivers because of more childlessness in this country, as well as some other factors. So it's a problem now that's just going to grow exponentially over the next 20 years. So we have to have a pipeline that is attracted to a viable living wage occupation. And I think that Rep. Dingell made a really great point that it's education of society in terms of understanding this, because nobody understands it. We're all enmeshed in it. I've been in it for 45 years. And even then, when I try to help a friend, it's so god-darn complicated and confusing and fragmented, you cannot figure the thing out. So, you know, we have to actually get society to understand the challenges of this system and that we're all in this together to change it.
Mm-hmm. Absolutely. So again, I'm hearing elevating is part of what I guess we'll call kind of the general consciousness, right? The national discourse beyond the people in this meeting, an understanding of not even just the challenges, but the incredible value of these professionals, as you said, Robyn, you know, and a situation that you don't recognize until you are faced with it. So, you know, those voices like yours, Henrietta, need to continue to be elevated and to be out there. And then I think what I'm also hearing is that we need to do more looking at the economics. Things need to be paid for, right? And, you know, we can talk about doing what's right, but ultimately the money has to come from somewhere, and maybe part of it is just simply understanding the costs and the benefits and laying that out, so that you can kind of override some of those concerns. And I think you started to do that at LeadingAge. There are pieces of that out there, and again, one of the things that I'm hearing is to continue to make those, to develop those arguments, as well as all of these kind of more human arguments, including the idea that, again, 4.6 million increasing to 6 million people being paid a living wage boosts everything in communities, in states, in the country, in so many ways. And we can try to quantify that. Not that numbers are always convincing, but I think at least it can help to, you know, kind of counter some arguments that we just can't afford it by saying, well, we can't afford not to, right?
Can't afford not to.
So I'm going to just read a couple of the comments here which are terrific, and we may see if we can try to compile some of the input that people are giving us in the chat and share that back out with you all in the email, and also include a link to Robyn's report and some other resources that we've mentioned in that email. But one comment is that these professionals are also the voices for their patients, and those patients can't always speak for themselves. I think that's a fantastic point. You know, commenting on, again, training medical and nursing schools and the whole care team, you know, as we've said, it is the direct care professional that is providing the bulk of the direct patient care. And yes, there are RNs and LPNs and therapists and medical directors, you know, but it's key to make sure that team is respectful of each other and works well together. And a lot of that can go back to the training and taking a look at how those teams are viewed and trained. And here I see training could be the next frontier in professionalizing the workforce. And again, I know this is not a new subject, but can we construct certifications? I know, you know, in Michigan now, community college is being made available to folks, including, I believe, tuition free to be able to get a CNA. And I know work has been done in this area, but I think time to also elevate that. And let's see, comment on oral health services, and Robyn, that you mentioned that.
Yeah.
Yeah.
Actually, there's a fantastic program at UNC. I'll give a plug for it. Cheryl Zimmerman and Phil Sloan They have developed a fabulous oral hygiene program, and this is a way to build the frontline, again, the frontline professional in terms of an oral health technician. And oral health for older adults is critical. Your teeth, your mouth is the gateway to everything else. So, there's a win-win there in terms of having older adults have better oral health care and having the front line also become specialists in this particular area. There are so many opportunities here.
I'll tell you a story on that, the mouth issue. I just had some major, had an implant, and the implant affected my jaw, and I got mandibular osteomyelitis and had to have surgery. And the doctor said to me that night after I came out of surgery, I was in the hospital, said, most people who experience what you have could die. And that's what we don't understand is, I did tell my dentist my mouth hurt, but he kept ignoring it for a while. But people don't have dental hearing.
No.
Think about what it's like to be older and not hear.
Yes.
And isolation and foot. Yeah, mouth is one of the keys. And I'm the minute I walk into the dentist office, I fear $1,000 bill. It's like, my teeth aren't that bad. I've tried to take care of them during the, but feet, especially for diabetics, people with high, bad circulation, and it can lead to really serious problems, and none of that is covered. And we need to work as part of that for this system as well.
That's true.
All right, we have a few minutes left. I'm gonna put one more question out there, I think, to our three panelists, and then I'm going to turn things over to Ann Montgomery, Director of our Center for Elder Care Improvement, to close things out. But I'm just looking at some of the questions again coming in, and I will ask each of our presenters, what are some specific things that providers, home care providers, nursing home providers, other residential providers can do to increase wages and more effectively recruit and retain direct care professionals? Pretty broad and basic question. But again, specific thoughts on what the providers of these services can and should be doing. Congresswoman Dingell, I'll turn to you first.
I didn't totally hear the question.
Oh, I'm sorry. Thoughts on any specific things that providers, home care providers, nursing home providers can and should be doing with regard to wages and recruiting and retaining direct care professionals?
Well, I think this gets complicated, because if you're someone like me who knows how critical this is, you pay a decent wage. You start there. You pay somebody what they're worth. And if you're paying someone enough money, then they're not living at the poverty level, and they're not having to work multiple jobs, etc. And it's a very vicious circle. Many people, we need to figure out long-term care in this country, because there are also people who are living at the poverty line that suddenly have a spouse or a parent who becomes very ill that needs caregiving, and they can't afford it either. And so but we shouldn't have people have to get impoverished to be able to get so it's a very vicious circle, but we need to address the system itself. And we need to fix the system. We need to pay a decent amount of money. We need to pay a living wage to caregivers, give them benefits, and make it a field that people want to go into and take care of it.
Absolutely. Okay, Henrietta, I'm assuming you're in total agreement with all of that.
Absolutely, 100%. And for someone like myself who advocates, and I'm an activist for the voices of the workers in this caregiving workforce, we can just keep doing what we're doing. The stronger and the larger we grow this number of workers to come out and speak and tell their stories, we could continue to get what we need and win this victory. It is a vicious cycle. It has been going on for too long, and then we're back at, you don't want to start creating a new poor, because you have to understand, if these workers don't get a livable wage with benefits and all the other stuff that you get as a worker, you're going to have a whole new set of poor moving forward. So we're going to keep having a cycle of poor people because of lack of wages. Is crazy to me. So I'm going to continue to advocate. I'm going to continue to use my voice and stand with these wonderful people on this panel. And that's how I feel we'll get victory. We're going to keep talking about it until somebody get tired of hearing us and say, you know what, do what they want, darn it.
Absolutely. Absolutely. All right. Robyn, I'll give you the last word.
I mean, I do think I agree with everything. I think providers have a role. Certainly LeadingAge represents nonprofit providers, and we are committed as an association as individual providers to transform this. These are employers, so they have to be at the table fighting for what they need. They also need to be looking at their own pocketbooks and look at money that is perhaps not being used well. You know, whenever I see a wage pass-through go through a state Medicaid, I worry, is that money going to get passed through directly to the frontline worker, to that professional? And so we have to be transparent, and we have to figure this out, whether we use a combination of money that we already have and new money, or money that's actually going to help us to support a frontline professional workforce. And I absolutely believe that at the end of the day, affordability of long-term care is the underlying challenge, which means that we're going to have to move beyond Medicaid and figure out some way where your average middle or modest income person, if they live to 100 years old, they got to figure out a way that we're all going to be able to pay for this in some way.
Absolutely. Absolutely. All right. Well, since we're at time here, thank you so much to our panelists.
Bye, everybody.
And Anne, you wanted to say final goodbye? Thank you, everybody.
Oh, yeah. Thank you so much, everybody. This is a tough subject. You hit it out of the park. And what I'll take away is respect us, protect us, and pay us a livable wage. So thank you. Thank you so much.
Thanks, everyone.
Well,
Thank you.